This is really going to have a significant impact on all first responders, especially the police community and especially the QPS, the Queensland Police Service. Those men and women go out every day in uniform and just don't expect to have something like this happen. There's always that risk, but to be ambushed in such a way, in a incident that should have never happened, is just going to have long-term ramifications for those that still wear the uniform and those that have worn the uniform for police around the country, and also the families. There's always that question around what is going to happen when you walk out the door, and are you going to come back, and are you going to come back the same person that left? And I think those questions are going to be amplified today and going forward. What are the risks that our first responders see every day and the implications for them? I think that is going to be a definite highlight of this tragic event.
It'd be unsurprising to see some mental scarring across the community and the families, as you said. What sort of support is out there available to them?
Look, you've obviously got the organisations themselves, so the QPS have an EAP and support services internal. You have a number of other organisations out there like Lifeline that can provide general support, and of course you have Fortum Australia that can provide specific support for first responders, mental health and the family support. And we've recognised since we first kicked off 3 years ago that providing support to first responders and their families is critical to allow them to continue to do the job that they do, that ultimately being independent and separate from the organisation provides a safe space for people to go and access support and recognise that getting it early is going to help them stay in their career longer and also support their family to be able to be an effective and resilient family unit.
Having access to those clinical specialists at Fortum who have specialist background in first responder communities, how important is something like that compared to people that are just for the general public?
Look, it's really critical to understand your clients, and that's exactly what we did at Fortum, is get clinical psychologists and mental health specialists who have worked in this area. They have worked with first responders, they've worked with veterans, they understand trauma and they understand supporting families. And that is absolutely critical in making that first connection with people who go through this. It's very hard to build trust if you don't understand what it is that the person is talking about. And we have done that insofar as built that trust. And that trust is critical then to opening up about the incident and opening up about your mental health in general. Otherwise, you just don't get the outcomes that you need for first responders and their families.
For those that may be seeing this and feel that they need to speak to someone, what's the best way to go about it?
So for Fortum, it's directly through our website, fortumaustralia.org.au. You've got our contact details there, as well as some of the activities and other programs that we provide. You also have Lifeline, which is available, and Beyond Blue as well for those general capabilities.
Anything you wanted to add?
Just that our psychologists are available not just in person, but also through telehealth. So if you are in remote and regional areas around Australia and you're serving, and you have a family member or are a family member that wants support, we can provide that through telehealth to access across the country, which is, again, really critical to make sure that there's no barriers to accessing good clinical support for you and your family.